I think that diabetes care will increasingly be individualized, and there will be increasing emphasis on the need to personalize diabetes treatment. This include being able to stratify diabetes risk better and also tailor patient treatment to individual profile so that we can more effectively manage our patients with diabetes.
So I was presenting today on the economics of diabetes. I focused on the use of simulation modelling, particularly those, or a particular type of simulation model that's was developed based on the UK PDS outcomes model. This can be used by both health economists and clinicians to understand the relationship between changes in risk factors such as HbA1c and long-term outcomes such as reducing rates of complications that are critical to improve patient care in diabetes.
My topic as part of this forum has been to discuss the changing face of diabetes complications that we've seen in the US and that we think we may be seeing around the world. Diabetes is an interesting problem wherein we've seen a number of successes, but we've also seen emerging new problems and challenges. And we've seen, for example, large improvements in the United States in the rate of complications. So the average person with diabetes actually has a lower risk of getting complications than they used to in the past. But at the same time, we've seen such a large increase in the problem of diabetes overall that we're still, and with people living longer and longer, even after they have diabetes and having a greater life expectancy, what that means is there's more and more years for people to develop not just the traditional complications that we're used to, like amputations and heart attacks and strokes, but also new problems such as cancers, disability, and continuing end-stage renal diseases being a major problem. So all of this is going to have effect on care in the future. It means that we're going to need to continue to try to have the same goals of improving care, improving regular risk factor management, good self-management, regular continuous follow-up with clinical systems and doctors and nurses, but also with systems and structures to support doctors and nurses and health systems to help make behavior change and risk factor management part of a regular part of care for everybody with diabetes, and that's what we hope we will continue to see, and this forum is a great opportunity to continue to stimulate that, and I appreciate
the prevention of diabetes in China. A translationless study in Tianjin because the prevalence, our data shows the prevalence of GDM increased during the past 15 years in China rapidly. So our data show the intervention during pregnancy and after pregnancy are effective. The first one that is effective to reduce the improve the pregnant outcomes. The postpartum lifestyle intervention can reduce obesity and reduce the insulin resistance among the women. Maybe reduce the risk of diabetes in the long run.
Okay, I think the trend for diabetes care in the future, I think majority of the care will probably have to take place in primary care because of the large number of patients with diabetes that we have to care for. And I think in order to serve the purpose, primary care will have to take a more system and multidisciplinary approach so that we can actually address all the different needs of the different patients with diabetes mellitus. And one point very important is the patient enablement and empowerment so that they can actually live with the disease and control the disease, and also to assure the quality of life to the best they can for the decades when they have to actually live with the disease.
So my topic is about cancer and diabetes. Now we've known for many years that diabetes leads to problems through its complications, through microvascular and macrovascular complications. But in the last 10 or 15 years it's become apparent that the influence of diabetes goes beyond those classical complications, and cancer is one of those emerging problems. And so we're seeing now in many studies an increased risk of cancer in people people with diabetes. The magnitude of that risk, it's important to recognize, is not as great as, say, for cardiovascular disease or microvascular disease, but undoubtedly it is there, and some studies are now showing that more people with diabetes are dying of cancer than there are of cardiovascular disease or any other cause. The links between cancer and diabetes are many. Some are due to biological factors, things aspects of diabetes, hyperglycemia, hyperinsulinemia, that may be driving the growth and promotion of cancers. There are other aspects related to increased or decreased screening of people with diabetes for cancer, aspects of treatment. There has been some questions raised about whether some therapies for diabetes might be increasing the risk of cancer. That appears not to be the case, though I think that episode is not quite closed yet. And then there are issues about how people with diabetes are treated once they get cancer, and there's some evidence that they're treated less aggressively and may respond less well to therapy. So there's a complex environment surrounding the links between diabetes and cancer that we continue to explore.
Well, my talk is just about education, and I think that the main important message that I try to express is that the best tool that we have to improve quality of care of primary care diabetes, particularly at the level of primary care, is just education. And education at every level means the physicians, the rest of the healthcare team, and as well just to interchange positions with the primary care level and the high complexity level. Then the common useful thing should be education, just to improve quality of care and of course quality of life of people with diabetes. That's my message.
So it's a great privilege to be here at this forum. I think the topic of preventing the preventable in diabetes is a really crucial one for the 21st century. I studied medicine in London, and I was driven to diabetes care by the notion that many of the complications are entirely preventable by better control of the complications of the condition, detection of the disease early, and by upstream prevention. And these are the things that have guided my career and have clearly guided this forum, which is an excellent opportunity to discuss the latest research and its implementation in clinical and public health practice.
Diabetes is one of the most common causes of end-stage renal failure in many parts of the world, and really accounts for up to 40% to 50% of patients requiring renal dialysis and renal transplant. And we also know that Asian diabetic patients have higher risk of developing diabetic kidney disease compared to non-Asian population. So using the JADE registry, we looked at 28,000 patients with type 2 diabetes from about 7 regions across Asia. And in this cohort, we found that up to 40% of patients had albuminuria, and up to 16% had chronic kidney disease as defined by GFR loss of less than 60 mils. And what is important is that patients with chronic kidney disease, so they are at very high risk of developing future cardiovascular disease, is that their control is very suboptimal. So only about a third of them were able to reach an A1C target of less than 7%, and only 20% of them were able to attain a blood pressure target. And also the use of very important life-saving drugs such as statins and RAS inhibitors again was also suboptimal in this population. And really the results from our study call for greater attention from the medical community in looking after these very high-risk patients.
This is my first time attending, but I've been extremely inspired. The speakers are amazing, and I think the topic that in particular we touched on about healthcare delivery and how we could better manage diabetes and also prevent it, especially in the community, and just hearing some of the world's best speakers on this topic has been a real treat. So I'm extremely excited and inspired.
This year we again have more than 200 participants, and we've also got some leading speakers talking on a wide range of topics, diabetes and cancer, education, integrated care. And I think this will be the big trends in terms of our strategies to combat and fight diabetes.